Hi, John. Thanks so much for coming here today. I'm really glad to be able to see you. Do you want to tell us a bit more about yourself?
Yeah, so I'm Jonathan Singer. I'm the president of the American Association of Suicidology. I'm
Mm-hmm.
an associate professor of social work at Loyola University, Chicago. I'm the founder and host of the Social Work Podcast.
Yeah, yeah.
I'm the treasurer of the Human Services and Internet Technology Association, and I'm the
Mm-hmm.
co-lead for the Social Work Grand Challenge: Harness Technology for Social Good. I'm also the co-author of this book, Suicide in Schools,
Mm-hmm.
which we're currently revising. And my focus is really on, the intersection of technology, suicide, crisis, health,
Mm-hmm.
mental health,
Yeah.
um, and social work. And I live in Evanston, Illinois, with my wife and three kids.
Wow, wow. That's a lot of roles that you play. Can you tell me more about what you're interested in, this intersection that you were talking about previously?
Yeah, so when I was a kid, I would hear my dad talking about computers. He's a
Yeah.
physicist,
Mm-hmm.
and he used punch cards for his dissertation, right? So
Yeah.
he used to use big computers, and I always thought they were really interesting. And uh, and I quickly learned that technology is everywhere in our lives.
Yeah.
And as I got older, I realized that social work, which
Mm-hmm.
is about people and it's about communities and well-being,
Mm-hmm.
oftentimes didn't think about the role of technology and the role
Yeah.
of computers in that process. In fact, some people thought
Yeah.
this was this shouldn't be part of the process. And
Mm-hmm.
so I ended up being one of those people who said, no, 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 we need to think about how computers can both help and hurt the
Mm.
human condition. And so that's sort of how I got started with that.
Mm. Wow, wow. Okay. Yeah, that sounds very interesting and bring the role of technology more into social services. Yeah. So I mean today I really wanted to explore more about how your expertise in social work and in mental health can really help social workers during this pandemic. So
Hmm.
I think one of the problems that social workers are facing is the increased demands on social services and then also the blurred boundaries as they work from home. I mean, what are some of your perspectives or suggestions around caring for the mental health of social workers?
Um, well, it's a good question. The uh, One of the things about um, sort of taking care of yourself is to understand that there are some things that are in your control and there's some things that are not in your control,
Mm-hmm, mm-hmm.
right?
Yeah,
And if you uh, if you're not used to being intentional about taking care of yourself,
mm,
meaning that you just go throughout your day and others are taking care of you in
yeah,
some ways, like you have somebody that makes your lunch for you, or dinner, or cleans your house,
yeah,
or that you get a lot of energy out of talking with folks in person. Like during the pandemic,
mm-hmm,
that could put some stressors on you because it's not what you're used to, and it's also taking some of these things that were naturally in your environment that really met some of your basic needs, and it removes them. And so being able to realize, oh, I miss um, being socially connected with people, even though I'm socially distanced from people, is
mm-hmm,
important. And there's sometimes when we just don't take the time to set up um, the kind of self-care plans that you need to have in order
Yeah.
to manage, you know, a historic pandemic like this. And
Yeah.
I have to say, like, nobody knows what to do
Yeah.
during the
Yeah.
pandemic. This is
Yeah.
a unique experience for all of us.
Yeah.
Uh, but anyway, so I think there are a couple things. One is to think about the fact that self care is a team effort,
Mm-hmm.
right? That uh, um, we think about ourselves as the helpers,
Mm-hmm. Yeah.
um, but unless we are able to uh, have those resources, the energy, the compassion,
Yeah.
um, the sleep that we need to be there for somebody else, we're not going to do a good job. It's not going to be an ethical service that we're providing. And so,
Yeah.
thinking about who's on your team is really important, and how is that team going to hold you accountable to doing the things that for you are going to allow you to take care of yourself and to be taken care of by others.
Mm.
I'm happy to talk more about that, but I'm going to leave that there for right now.
Yeah, yeah, sure. I mean, so being intentional and actually thinking about our own self-care plan, and then also thinking about the team that is around us. Is that what you're suggesting for social workers?
Yeah. So, for example, um, there's these days I'm at home right
Yep.
now,
Yep.
and this is where I like this spot right here is where I do my social work these days.
Mm-hmm. Yep.
And so the question is, what happens outside that door?
Mm-hmm.
How does my family understand what I do, or they don't understand what I do, but I sort of set it up so that I can still do this. Um, and for today, that looks like making sure that my wife had her coffee before I came up here, that she
Yep.
was able to go out and take a walk,
Mm-hmm.
before I started this, and that one of my sons, is dressed
Yep.
and has something to eat. Right, so it's kind of taking care of those things. But then, um, when during the day do I need to uh, get up and exercise? How do I make sure that I have enough water to drink?
Mm-hmm. Mm-hmm.
Um, some of the basics, and so, for example, what I've done is I've told people uh, this is going to be a walking meeting,
Mm-hmm.
right? And so they know that when they call, I'm not going to be sitting in front of the computer. I'm going to have my earphones on and I'm going to be outside walking the dog.
Yep.
And that's going to be part of my day to get exercise. And they know that this is part of my self-care plan,
Mm-hmm.
and it's built in. And in fact, I've had people say, "Hey, why are you on the video?" I was like, "Oh,
Yeah.
blah blah blah," and they're like, "Aren't you supposed to be walking now?" Right? So they support me to get out there and get exercise. Um,
Mm-hmm.
and so the physical stuff is just one piece of it. Um, Having somebody or one or two people who can really be a team, and you guys can check in together about how each other is doing, can be really powerful in terms of creating a little pod or a bubble of support where they get to say, "Hey, I know that this week you were really stressed out about this project, or you were working with these clients.
Yep.
um, uh, were you able to do the things that you said you wanted to do, and how can I support you to do those?" So those are having a team to support you is a really important thing that social workers can do at this time.
Yeah, yeah, yeah. Thanks for that, Jonathan. And I think, I really want to explore this role of technology and actually making social work possible during this time. And that has actually caused blurred boundaries between work and home. So in the past, social workers could leave their work at work and then come home and then not think about it. But now social
Yeah.
work is in your room. So how do you differentiate the boundaries then?
I mean, it's hard. Like, I think that's the first thing to acknowledge is that um, uh, this isn't an easy thing to do. And the reason why I say that is because um, if you are in reality with what's going on, then it's
Mm,
easier to figure out what you need to do to take care of yourself. Um, for example, we talked about scheduling this appointment or this conversation, and
yeah,
I said I couldn't do it at the original time because that is during dinner and bedtime with my kids.
yeah,
So I set a limit. I set a boundary, and I said this doesn't work for me. What about this other thing?
mm,
Now, obviously, what you and I are doing right now is it's not a requirement. Like nobody's gonna get kicked out of their house
yeah,
or
yeah,
be removed from their home for abuse if we don't
yeah,
have this interview. So this is
yeah,
this is really low stakes, but um, uh, making sure that if you are providing services from home and you're using a webcam and let's say you're interacting with clients, number one, make sure that your environment that you're
mm,
in um, is something that you're totally comfortable being in, not just for
yeah,
you personally, but also that you are comfortable having your clients see you. So, for example, I've got books on the shelf, and I've got I have a picture of my family back there,
yeah, yeah,
right?
yeah, yeah,
Um, and if that was something that I didn't want my clients to see, I would need to change my environment so that when
mm-hmm,
I walk into this space, I can just know that I can feel relaxed and comfortable, and like nobody's going to be thinking about, well, what's going on behind me.
yeah,
Um, and so that takes care of kind of the um, at the neurobiological level.
mm-hmm,
It takes care of a sense of calm and safety and security inside my body so that my
yeah,
brain isn't going into kind of a protection or a stress mode,
mm-hmm,
right? So then when I focus on the client, when I focus on you or whoever's on the other side of the webcam,
yeah,
I can be present like that.
mm-hmm,
um, and I think that's a really important thing. I think the another piece of this is um, making sure that your technology is working.
yeah,
So if somebody's relying on you to be available, so let's say you're my client, I'm the social worker, and we're supposed to have a therapy session, and my internet isn't working,
mm-hmm,
that's stressful for both of us. And so thinking through how can I make sure that even if my Wi-Fi isn't working, that I have some backup. Maybe I use a hotspot on my
yeah,
phone, right?
yeah,
Um, and just being able to think through some of these tech things, or maybe realizing that I need to increase the bandwidth, and so I have to call my service provider and
mm,
talk about having going up to the next level. These are details, but
yeah,
they're the little things that make it so that um, instead of getting caught up in
mm,
the technology works for you.
mm. Yeah, so being able to create a safe space for yourself to meet these clients and also being able to deal with the technology side of things. I mean, I think what do you suggest can help social workers to actually switch off now that social work is in their home after work hours?
Yeah, so well that's what I was saying. So one of the first things is to make sure that you know what after work hours are,
Mm,
right? I mean, it, when and this is something that social workers have dealt with for a long time now, right? In that you're going to have people that can text you all the time,
yeah.
right? And so um getting used to saying, look, at 7 o'clock, I'm done. But what happens when your client is in crisis?
Mm.
Who do they contact, right? What happens when your supervisor calls you and says, hey, we got a situation and we need you to get involved?
Yeah.
Like, having conversations in advance is really helpful. And so, what I recommend for all social workers is, when it comes to technology, especially now, is to make sure they have um, a technology and social media contract uh, or policy with their clients. And so what
Mm.
that says is it goes through all of the different modes of technology, and it says, this is what I use, this is what I don't use, this is how I use it, this is how I won't use it. If you
Yeah.
contact me, this is how I will respond or I won't respond. And it's
Mm.
everything from email to texting to social media. I'm on Twitter, I'm on Facebook, I'm on Instagram, right? My
Yeah.
Instagram profile is public, my Twitter's public, my Facebook is not public. If I have a client that follows me on Twitter, they know what my rules are. I'm
Mm.
not going to respond to a client that tweets at me. I'm not going to follow a client that follows me. I can't
Yeah.
stop them from following me. Like, I'm not going to block them.
Yeah.
But all of this is set out in a social media and technology policy. And so what you
Mm.
can do with that with your clients is you can say, look, um, I know that I'm not coming to your home and you're not coming to my office. These are the new rules, and let's talk about this.
Mm-hmm.
So if you are in crisis and it is after 7 o'clock, here's what you do. And I've checked that out with the crisis services, right? So I know what it's like when they reach out to the text line or the hotline, and
Yeah.
we
Yeah.
have those conversations.
Okay. Yeah. Sure. Yeah. That sounds really important. I mean, so what do you think is the most important thing or principle for social workers to take care of their own mental health during this time?
Um, I don't think it's just one thing, and I think
Mm-hmm.
that it depends, right? So um, I actually think that for some social workers, the pandemic has improved their mental well-being.
Mm. Mm. Yeah.
I don't know what it's like in your town,
Mm-hmm.
um, or city or neighborhood, but in the Chicago area, people spend a lot of time sitting in traffic,
Yeah.
and that's very stressful, right?
Yeah.
And so if I'm going to my office and I'm stuck in a traffic jam and I'm late to my client, or I'm late coming home, that adds to my stress.
Mm.
But during the pandemic, it's much easier for me to come upstairs and click on a link and be there.
Yeah. Yeah.
And so I think that a lot of social workers in the United States, at least, I shouldn't say a lot, some of the social workers that I've talked to have actually felt um, uh, a relief that they don't have to deal with some of the barriers to self care that were
Mm.
present before, such as not being in control of traffic, having to sit on public transportation, and
Yeah.
dealing with people that are, sick or angry or just around, right? So they
Yeah.
can just
Yeah.
come up and sort of be in their zone and focus.
Mm. 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 Yeah.
And so it's not all bad. But so I would say that uh, these are uh, these are some of the blessings of the pandemic for social work, and of course there have been other things that are stressful as well.
Yeah, yeah, yeah. Thanks. That is very important to actually note that there's actually a flip side to the pandemic that's not all bad. So, I
hmm
mean, even as we wrap up this interview, are there some things that you want to share that I haven't asked?
Um, No, I think that uh, your questions are really good. We could have sort of dived in even deeper into all of them, and I
Yeah.
think that you know um, this idea of self care
Mm-hmm.
is definitely um, historically and culturally dependent.
Yeah.
So I could think about in the 1950s, what did self care look like, right?
Mm. Yeah.
And in the United States, it might have looked like me being part of a bowling league, right?
Mm.
And having a barbecue, on Sundays with
Yeah.
everybody in my neighborhood. And
Yeah.
today, it might look different. It might look like walking on a treadmill in my basement.
Yeah.
Um, or spending 5 minutes on TikTok with my kids and watching funny videos, right? So it changes with time, um, uh, but I think the thing to remember for everybody about self care is that
Mm-hmm.
one, it's a team effort.
Yeah.
Number two, it is something that you have to plan, and
Mm-hmm.
you have to sort of address how it's working for your physical, your emotional, your environmental
Yeah.
needs. And not to forget that there are some things which, as an individual, you can't take care of. It's really society or the state
Yeah.
or whatever
Yeah.
structures that are imposing things on you that can be incredibly stressful and make it hard to take care of yourself. That it's important to be able to advocate for those things to change, so that
Mm.
it all doesn't come down on the individual. So I think that's the
Yeah.
last. Maybe that's the last thing that I would say is that self care is not about being okay with a bad situation
Mm-hmm.
just to survive. It's about being okay so that you can change bad structures and systems
Yeah.
for the betterment of everybody.
Wow. Yeah, that's really insightful and thought provoking. I'm so thankful for your time, and I'm sure this particular interview will help a lot of social workers in Singapore to think about how we can improve our self care. Yeah, thank you so much,
Yeah, you're
Jonathan.
welcome. I'm
Yeah,
so glad that you invited me on.
yeah, thank you.